Hello everyone, my name is Zach Hansen. I'm a physician assistant working alongside Dr. Kurtis Staples for Sonoran Orthopaedic Trauma Surgeons in Phoenix, Arizona. Today, we're taking you into the OR to show you the step-by-step process of harvesting bone to be used for bone grafting. The reason autografting is important in these patients is because using a patient's own tissue ensures no risk of immune rejection or disease transmission. There is faster incorporation into the body and quicker healing leads to an expedited recovery and return to activity. Here, we will walk through numerous X-ray examples, starting with an ankle fracture dislocation with significant bone loss to the distal fibula segment.
This is the intermediate fixation film. We fixed the fractures, but given the extent of the injury, that portion of bone never healed. Due to this, we went back to the operating room to remove all of the bone lacking adequate blood flow. With that bad bone removed, we inserted bone graft directly into that site.
Here are X-rays of a humerus fracture which demonstrate the same process of fixing a traumatic fracture which eventually needed definitive bone grafting.
Due to the extreme bone loss from a gunshot wound, during the initial surgery, we had inserted a bone cement spacer as a temporary placeholder for future grafting. After about 8 weeks from that initial surgery, we returned to the operating room to remove the bone cement spacer and place the final bone grafting products for healing.
Now that we've discussed bone grafting and the non-union of fractures using X-ray examples, here is direct operating room footage showing the point-of-view surgical process of harvesting bone to be used for autografting.
We begin by making an oblique incision just above and lateral to the gluteal cleft, in line with the posterior iliac crest. This incision will allow for an ideal approach down to the graft site. We use an electrocautery knife to help with the dissection. This tool not only cuts tissues, but helps to coagulate blood vessels to help control blood loss during the procedure. We use some self-retaining retractors to help expose the surgical site further. As we approach the bone, we can see the gluteus maximus muscle. We take the electrocautery knife and reflect a portion of the glute max directly off the posterior crest of the pelvis at this interval. Performing a dissection that minimizes damage to the soft tissues allows for the best and most pain-controlled recovery. Once this dissection is completed down to bone, we begin the process of harvesting the bone graft. Using interchangeable gouges and a mallet, we drive into the posterior crest and begin collecting large strips of cancellous and cortical bone. For the volume of bone graft that we often need for non-union fracture sites, the posterior pelvis is the best location in the body to obtain it. These sizable chunks of bone do not need to be milled down. We will insert them directly into the non-union graft site. In order to get to the posterior pelvis to harvest bone, the patient is positioned prone or on their stomach on the operating table. Typically, once the bone harvesting is completed, the incision will be closed and the patient will then be positioned supine or on their back for the actual grafting part of the procedure. Due to this, we ensure to collect as much bone as possible at this time to have all the necessary bone for grafting. Now that the largest pieces have been removed and collected, we use a smaller gouge to scoop out additional bone from the deep pelvis. This functions as a blade to scoop up this final layer of bone. Once the harvesting is complete, we begin the wound closing process. Using a strong dissolvable suture, we approximate the subcutaneous layer of tissues. A tight closure at this level helps to prevent excessive swelling and hematoma formation. In addition, we want to avoid a surgical site infection as this is on the patient's backside. An airtight closure helps to reduce infection risks. Not shown here, but after the subcutaneous tissue is closed, we use another dissolvable suture on the most superficial layer of skin. This adds another barrier to protect against infection and to help the tissues heal properly. Once our wound closure is complete, we will place a final bandage over the incision to conclude this phase of the bone harvesting and bone grafting procedure.
Thank you for joining us on this point of view walkthrough of bone graft harvesting. Make sure to subscribe to the channel for more insights into the orthopedic trauma OR.